Welcome back to the Popped Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today, we're starting with a little Popped quiz. Pop quiz on the Popped Podcast. Some of this you might have gotten from last week's episode. Hopefully it sticks with you. Some of this you might not know, and that's okay. And some of it might be obvious. But I want you to tell me whether babies are born with it or they develop it over time. So starting with the sucking reflex. Are babies born with it or do they develop over time? Born with it. They present in the womb and it actually starts in the womb, but usually you can see it sometimes if you're getting an ultrasound and they're doing it with their thumb. A lot of times it's on their hand or their thumb, but you can see it and it's controlled by many cranial nerves, which we're diving more into today. Second, turning their head towards your touch. Are they born with it or do they develop this over time? Born with it. This is your rooting reflex. It's active at birth and it helps with feeding. Smiling when you smile. When you smile at your baby and they smile back at you. Are they born with it or did they develop this over time? This is developed over time. Yes, your baby can smile at you, but a lot of times those are neurological reflexes early on in infancy. And social smiling, when they actually respond to your smiles with a smile, that actually starts around 6 to 8 weeks postpartum. Coordinating suck and swallow with breath. Are they born with it or do they develop it? Born with it, kind of. This one is kind of funny because this is an instinct to be able to suck, swallow, and breathe, but doing them all at a coordinated time does take practice for full coordination of all three together. Sometimes you might notice baby accidentally chokes themselves because they didn't breathe when they swallowed or sucked. This is them just figuring it out. It does take a couple weeks for them to develop a more smooth routine of sucking, swallowing, and breathing through their nose while doing all three. Babies are not always inherently able to just breathe through their nose. And so sometimes that gets confusing when they're breastfeeding and they're trying to breathe through their nose while they're also latched around the boob. Next, we have making eye contact and tracking your face. Are they born with it or did they develop this over time? This is developed over time. Vision improves gradually. Tracking and recognition comes with growth. What they can see and do is make eye contact with you at breastfeeding. That's about the distance that babies can see. And most of the time, if they're making eye contact, it's with mom in that position. Next, we have latching perfectly, which we went over last week. This develops over time. They do try to latch, and a lot of times they're successful at latching, but a perfect latch with their lips wide all the way around the nipple, making sure that they are sucking from the proper sides of their mouth, top to bottom, side to side. That does develop over time with support. That's why breastfeeding doesn't always feel like it comes so naturally. It is a natural practice in life. It is really natural instincts within a mother's body and for baby to feed from a mother's breast. However, it does take some time for everybody to get into the rhythm of their breastfeeding experience and journey. Next, I have recovering from stress with touch or movement. That means being calmed down by touch or movement. Babies are born with this. This touch and this movement very much stimulates what they experience in the womb. Usually full surrounding amniotic fluid, that's pressure all around their baby, and then movement from your body. Now that they're not surrounded by amniotic fluid, that skin-to-skin contact, holding, baby wearing allows them to feel that pressure and closeness to your body with also moving with mom's movements. Since they're so codependent and they're co-regulating off of your body, they're really used to your movements and your rhythm of tone as you step, as you move, as you bend down. And so that's really familiar for them, and that can really help them calm down. because they experience it so much during pregnancy, they're born with it, and it maintains that same calmness and familiarity in that early infancy period. Next, I have calming themselves down, being able to soothe themselves. Developed over time. Babies are not inherently built to be able to soothe themselves. They do have to learn this over time. It doesn't mean that babies have to learn it by themselves. A lot of times, babies don't know how to learn things by themselves, and they need us to help show them how to do things. One that I see often is this soothing themselves, and something we've talked a lot about in our family. If you always pick up a baby, they're never going to learn how to soothe themselves. Well, you don't necessarily have to pick up the baby every time to soothe them, but can you show your baby how to soothe themselves? If you get frustrated in moments, can you, in front of your baby, show them, okay, I'm frustrated, but I'm going to take some deep breaths, show them how you calm down, maybe roll your shoulders, add some movement, breathing, whatever it is, changing your posture, all the things that we talked about multiple episodes ago with that pause. If you're just checking your posture and checking how much air you've gotten for the day, unwinding any tension in your body, a lot of times babies able to learn those soothing mechanisms and mirror them when they need to, or when you help them walk through it. Breathe, and you show them how to breathe, and you relax your shoulders, and you give them some physical touch. A lot of times showing babies how to soothe themselves actually is what they need, and that's what helps them to develop those calming tools over time. Next, I have startling with loud noise. Born with it. Everybody's startled with loud noise. It scares you. It's what keeps you alert and aware and able to startle, jump, and then get yourself to safety. That is a safety mechanism built within all of our flight or fight responses. Next, I have digesting calmly and consistently. Built over time. Baby's system hasn't digested food. It's all been through that umbilical cord coming in and throughout the umbilical cord. They haven't had to digest or poop or pee anything out really on purpose. And now, in order to get that stuff out of their body, they're going to have to do that. It does take time for them to learn how to utilize their internal organs and build muscle around the organs to help those organs do their natural function every day without the baby thinking about it. You have smooth muscle that lines all of your organs, and smooth muscle is involuntary muscle. You can't think about it to contract it. It's just going to happen on its own physiological response. So babies have to build that physiological response, and that's why doing those rubs on their tummy when they're constipated, or even doing tummy time, actually helps them put pressure on their bellies to start finding that new digestion pattern. All of these things are helping baby to learn and become more acquainted with their own body and the world around them. Next, breathing on their own. They're born with it. It does take them by surprise because all of a sudden they have to take oxygen in, push CO2 out, and then they have to do it over and over for the rest of their lives. That's a really quick, you got to be able to do it and then be successful at it. That's why our bodies are built with lungs and breathing mechanisms, so that we know as soon as your body needs more air, it's actually going to initiate your vagus nerve, tell your brain to inhale it with your lungs, expand your lungs, your diaphragm pulls down, all the things that happen. Your baby knows how to do it because it's already wired within the body. Crying to communicate. Born with it or develops over time. This is innately in their bodies. They have no other way to communicate. A lot of times, or not a lot of times, but I've heard it before where some people will say babies learn how to manipulate you with their cries. They know how to get your attention. Realistically, that's just how they're communicating with you. And even if they are trying to get your attention, usually it's because they're trying to communicate something to you. So crying is something that babies are born with, an innate response to being able to communicate their needs or what they're experiencing or feeling. If things feel scary or new, or they're confused or whatever, they're going to cry. Preferring to look at faces over objects. Born with it or developed. Born with it. Babies and humans are hardwired for human connection. So babies are always going to look for human faces. That's why when we play peekaboo and you put your hands in front of your face, babies have no idea where you went. they are so locked in on facial recognition because it is human connection. They like that human connection. It's something for them to interact with. Toys, yes, they can interact with them, but they don't get a lot of response from toys except for our loud, stimulating toys. That's why babies like to play with them. But they do prefer to look at a person's face other than a plain object. Okay, hopefully you passed. There's no right or wrong, pass or fail, but I hope that you feel more confident in some of those answers. And if you don't, now you know the answers and you can start to reframe your ideals around these different things that baby is born with and not born with. Today's episode, I don't want anybody to shy away from or get scared because it sounds sciencey and why would I need to know about the cranial nerves? Don't let it scare you. This is all for information and just to have some more awareness of how intricate, complicated, in the best way your baby is already designed to be and to function. It's really so cool. Last thing I want to say though about the popped quiz, there is a pretty fine line of, well, I guess maybe not a fine line. There's a slightly blurry line between what baby is born with and what baby develops over time. The one thing that ties it all together, whether they're born with it or not, is their nervous system and their nervous system's ability to take in the things that they're not born with and they have to learn and start feeding it into their biological natural functions that are going to be normal for the rest of their lives. So the nervous system is why I want to talk about cranial nerves today. I talk about the nervous system in the body all the time with being a chiropractor and adjusting the spine, but I want to talk about the nervous system in ways that we don't always see or can't visibly or touch, areas that we can't touch that are still helping our bodies function the way that they're supposed to function, and that's through our cranial nerves. So I hope that you are still here and you haven't closed out of this episode yet. But why this matters. Your baby is born, they take their first breath, they turn their head towards you, they start to try to latch, and then they begin to nurse. What's happening behind all the scenes? What is allowing them all these little fine, it looks like they know exactly what to do. What allows them to do all these things that they know exactly what to do? And that's why I'm sharing about it today. This episode is not for you to memorize and be able to recognize which cranial nerve does what. That's what I studied in school, and that's why I'm here to hold on to that knowledge for you. What I want you to get from this episode is the ability to detect when a cranial nerve might be in dysfunction, or why some things that are happening with your baby probably aren't random things that happen to every baby, why they might actually be tied to something that happened during pregnancy, labor, or birth that has now shifted the function of their cranial nerves. And then how we take care of that, how we're able to identify it and then take care of it. So let's get into it. What are the cranial nerves? Cranial nerves are a set of 12 nerves that originate from the brain and come out through the skull, not the spine or the spinal cord. All of the rest of the nerves in the rest of your body come from your spinal cord, housed by your spine. That's why I always talk about the spine and why it's so important to get adjusted. We're going up from the spine inside of the cranium where your brain sits. There's a lot of holes at the very bottom of your cranium where these nerves come out and start to work and stimulate your body functions, your face functions, your hearing, sound, a lot of senses that we experience. The cranial nerves control movement and sensations in the face, mouth, tongue, throat, neck, and some internal organs. Why does this matter for newborns? Cranial nerves are responsible for nearly every interaction with your baby. I would say at least for the first 12 weeks, if not longer. We're building on a lot of these reflexes, on a lot of these functions of these nerves over time for baby to become more and more human. We're going to go through these nice and deep, but I'm just giving you a brief overview. Feeding, which is latch, suck, swallow. Breathing and calming, being able to rest or calm their breathing and bring themselves to a parasympathetic state. Reflux or frequent spit up, usually irritated spit up where they seem fussy when it's happening. Favoring one side, often diagnosed as torticollis. Facial asymmetry or flat spots, and poor sleep or frequent startling. These may be signs of nerve dysfunction, compression, or immaturity, all which could have happened either during pregnancy, labor, birth, immediate golden hour period. So, what do these nerves actually do? Starting with feeding and oral reflexes, which I just said, the swallowing, latching, sucking. Feeding is a full body job, and a newborn does it very instinctively, but not effortlessly. That's why I said earlier, they often need support to get better at breastfeeding. There are multiple cranial nerves that coordinate every suck, swallow, and latch. So we have the rooting reflex, turning the head towards the breast or bottle, latching or sucking, swallowing safely, and gagging to protect the airway. These are the key functions that your cranial nerves are trying to coordinate so that baby can actively get through this process or this journey successfully. So we have cranial nerve 5, it's your trigeminal nerve. This is your spotlight operator. This helps baby feel touch on the face and opens the jaw for latching. So they feel it, they're like, oh, right here, spotlight right here. This is where I want to feed. Cranial nerve 7, our facial nerve, has multiple functions, but this is what I like to call the lip sealer. It allows baby's lips to actually go around the nipple or the bottle top and latch or seal their lips around. It also allows them to make facial expressions with their mouth. Then we have cranial nerve 9, our glossopharyngeal nerve. This is your safety monitor. This one protects the airway and the gag reflex and helps to start the swallow. So swallow is very involuntary, but obviously you have to get your food back there for your body to start the involuntary process of moving it down into your stomach. This nerve allows that food to get back there and start the swallowing mechanism while allowing the uvula in the back of your throat not to cause an actual gag and spit everything back up. And we have cranial nerve 10, our vagus nerve. This is our CEO of calm. This will always be our CEO of calm for all of our lives. This nerve allows the swallow to start happening while also regulating the nervous system. The vagus nerve is what stimulates parasympathetic responses, and parasympathetic is rest and digest. When you are in a parasympathetic state, your body is trying to rest and digest. When you're feeding, obviously we need to digest, so we need to stimulate the body to be in that state so that your body can actually digest what's coming into it. So we want to stimulate that vagus nerve, which is what's going to happen as soon as baby starts sucking and swallowing. Then lastly, we have cranial nerve 12, our hypoglossal nerve. This is our tongue coordinator. So this nerve is going to make sure that the tongue moves smoothly in and around the nipple to keep getting that latch, keep getting that lapping motion so that the tongue can use its waves to get the milk out of the breast and into their mouth, down their throat. When any one of these nerves is struggling, feeding can become really noisy, uncoordinated, tiring, and even painful for both baby and mom. Before we continue on, if you notice any one of these things might be happening with your baby, you're like, oh my gosh, I remember that might be a cranial nerve dysfunction or something. Almost none of these are emergent. There is no emergent need here. You do not need to rush your baby to urgent care. You do not need to rush them to a pediatrician. A lot of these can be done with body workers, sacrocranial therapists, or chiropractors, which often have sacrocranial training. So let's move on to airway and crying regulation. Breathing, crying, and regulation are not just autonomic for baby, they are neurological, and they actually come from brain stimulation. A calm, coordinated baby often has a well-supported nervous system at the root, not just in their brain, but their full nervous system. The key functions that baby needs is coordinating the suck, swallow, breathe rhythm, crying and vocal tone, and regulating heart rate and digestion. The nerves involved in all of these to help baby naturally do them are cranial nerve 7, facial. We have that emotional broadcaster being able to tell you, I am sad, or I am happy, or I am confused, all the different facials baby's able to give us. Cranial, and note on that, the way that you use your face and express towards different things, your baby will absolutely start to pick up on and start to mimic and mirror. That's why a lot of times, I'll hear moms, my mom says it to me all the time, like, you just made a face just like your dad. When you see those facial expressions so frequently back at you, you start to mirror exactly the different facial features that are pulling, using, engaging to make that expression happen on their face. So you'll notice your baby will eventually start to mimic and mirror your own facial expressions. Next, we have cranial nerve 9 and 10, glossopharyngeal and vagus, both airway guardians. Obviously, we're trying to relax and have a calm breath. It's hard to take calm breaths when you're stressed out and running, right? That's sympathetic state. So vagus nerve bringing us back into parasympathetic, our rest and digest state. And then glossopharyngeal, we're protecting the throat. So we're controlling our swallow and our voice to match the tone of whatever we need in that moment. Swallowing, obviously, we still need vagus nerve to be helping with that. Glossopharyngeal is going to protect the throat, and then any sounds that come out vocal wise, these nerves are going to help make sure that baby doesn't damage those vocal cords. Moving on to cranial nerve 10, we already talked about the vagus nerve. It's going to help oversee that heart rate, especially for crying and airway regulation. In order to have a calm, stable airway, you have to be in a calm state, and your body knows that. And so when you initiate, or you're trying to show baby like, and you're trying to get them to breathe with you, this is actually going to help them activate that vagus nerve and match your breath. That vagus nerve then will take them deeper into that parasympathetic state and actually start to regulate more balance between sympathetic and parasympathetic. Lastly, I have hypoglossal for this one. This is our rhythm keeper, keeping the suck, swallow, breathe timing really smooth. Again, like I said, it takes a while for a baby to understand how to breathe, suck, swallow all at the same time without choking themselves. And the hypoglossal nerve, because it controls that tongue and it controls the airway that comes from your nose back behind your mouth and down through your throat, it allows that airway to not get so jammed up or clogged where they like choke on their breath or something goes. You ever feel like when you drink, have a random drink and you're like, something went down the wrong tube? That's what this nerve is helping baby to not experience. It's going to happen sometimes, and that's when we see our little, like, there's choke a little bit and you got to pat them on the back. But this is what that nerve is for. The vagus nerve in particular is our superstar here, especially with our crying babies. It's really going to help your baby settle after a stressful response or stressful experience, event, whatever it is. And again, babies have to learn and develop how to initiate and engage that vagus response. A lot of times it comes from parent helping them try to get there. Baby can't just on demand listen to your cue, like take a deep breath. They don't know how to do that. But when you show them and do it over and over repetitively, they do start to mimic and mirror you because they're baby. So let's move on. We've got movement and muscle tone. How your baby moves their head, reacts to sound, or holds their body posture, it's all tied to cranial nerve function. It all starts at the very top of our nervous system, right in our brain. These reflexes are more than just cute. They're actually diagnostic and tell us how your baby's brain is actually functioning. They can really help identify any small nuances in what a baby is going, or a human is going to experience and perceive, and then also reciprocate that experience back out to the world. All of those senses come in and through our cranial nerves, and so it's really important that we can identify those nuances so that we can know what babies' experiences in the world. This is a lot of times how we find babies hard of hearing or hard of vision or stuff like that. So the key reflexes a baby needs to have at this point through their movement and muscle tone is the Muery reflex, which is their startle reflex, their ability to startle and become aware if something happens. This is a safety reflex. This allows you to protect yourself or know that something is happening. Tonic neck reflex, this is fencer's pose. This allows babies to sleep, but also just expand their body. This is going to be a natural rhythm in which they sleep and lay and get into a comfortable position. And then head turning. Lots of nerves involved. A lot of ones we've already talked about and a couple new ones. We have cranial nerve 8. This is the hardest one to say in my opinion. Vestibulocochlear. It's very long. Vestibulocochlear. This is your balance builder. This helps your baby sense motion and space and triggers the startle reflex. This nerve does a lot. It has branches off of it. It does a lot in and around the ear, but it allows babies to find some sort of balance. This one we don't see a ton of expression-wise, or if there's dysfunction until they're sitting up or trying to sit up. If they're constantly falling to one side, you can more often see or diagnose this cranial nerve to be dysfunctional. Then we have cranial nerve 11. This is your accessory nerve. This is your head turner. So this is the one nerve that actually goes down into the muscles in and around your shoulders and help turn your head and lift your shoulders. Spinal accessory nerve, when somebody comes into our office and they're like, I have a really tight lat or really tight trap or really tight neck, a lot of times it doesn't often have to do with anything below their neck. A lot of times it has to do with cranial nerve 12. I see it a lot in post-car accident patients when they have a little bit of that, not even a little bit, but just a normal amount of that acceleration, deceleration force in their spine. It can put a little stress on that accessory nerve, and then the muscles are then tensed from it. And depending on where they're looking, it could be one side, the other side. Anyways, accessory nerve is really cool because it's not just around the face. It actually goes into the muscles that help us use our face and find senses within our world. Then we have, this muscle also helps babies lift their head and start to rotate. Well, I said the rotate head part, but lift their head, stabilize their head. This comes with time. If your baby is stabilizing their head by week 4, your baby does have too much tension in their body. If they're bobbing their head around looking for the breast in golden hour, they're probably just doing their natural instincts to try to find the breast during golden hour. Next, for movement and muscle tone, we have cranial nerves 2, 3, 4, and 6. These are your visual team. All the nerves needed for these little eyeballs to see around, know what's happening, and receive that information, send it back to the brain. All of these are your trackers. They help your baby follow movement, find your face, and process visual input. Exactly what I just said. Great. I like to say what I think I'm going to say and then read exactly what I wrote. And then it ends up being almost identical. Anyways, if baby is consistently favoring one side or struggles with tummy time, these nerves are most of the time the culprit of what's going on. Either some tension or stress in and around the nerve where it exits through the cranium. And if there's been any specific pressure or compression through labor and birth, that puts some pressure at the very base of their neck. Next, we have sensation, expression, and tracking. This is how babies are able to connect. Their connection is a neurological experience. Babies feel, react, and bond through cranial nerves that process sensation, control expression, and support early vision. The key factors we have for expressing and tracking are facial recognition and expression, eye tracking and bonding, and then balance and spatial awareness. So we have cranial nerve 5, trigeminal, our face feeler. So when your baby needs to do, or when you practice the rooting reflex, if you brush your baby's, the side of their mouth or brush the side of their cheek with your breast or your nipple, and they turn that way, that actual pressure that they're feeling on the side of their cheek, they actually have to feel that. So that pressure is where this nerve comes in. Cranial nerve 7, our facial nerve, is what is the actual emoter of our expression. This is what helps us express the emotion that we're feeling on the inside. Cranial nerve 2, 3, 4, and 7. This is the same team, the visual tracking team that we had in the last section. These are our eye movers. This allows us to track and move and actually follow people in and around the room, and then start to focus on certain things. And when we start to focus, then they start to comprehend a little bit better. Then we have cranial nerve 8, the vestibulocochlear, hardest one to say always. The motion sensor, this is going to help baby know where they're at in space. This is their proprioception, their ability to know where they're at in space, feel if they're falling. That's what will start their Muery reflex. This allows them just to express and feel sensation on their body. If your baby struggles to make eye contact or has uneven facial movements or startles really easily with motion, more than just the Muery reflex startling, these are really great clues to give providers for them to look at when and if you go see a provider. This is going to help them take a deeper look at all those cranial nerves and the nuances that I was talking about to see where exactly some of these, they use the word in school that I feel is really harsh, but lesions. And you can have small lesions, which are not necessarily a bad thing. When you hear me say lesion, I would rather say a nuance or a marker, like, hey, something right here. It doesn't mean you have this crazy lesion somewhere on your nerves. It just means there's a little bit of dysfunction with those nerves. Anyways, when you can recognize these small things, yeah, they're not expressing on this side of their face, or they only look at me this way, and if I stand on this side, they won't look at me. These are small clues that you can tell your provider, and they're like, we need to do a cranial nerve exam. If they don't do a cranial nerve exam, or they don't say that they are, you can always ask for one. In summary, with all of those, you do not need to become some anatomy expert. I share all those because I want you to know that we're not just talking into the abyss of cranial nerves and they all matter. If you know which nerve does what, even just a little bit, one time, and you comprehend none of this, you've brought your awareness to all these nerves doing all these different functions in your baby's body to help them process and integrate the world around them. Dysfunction is common, especially after long births, traumatic births, hard births. It's not a bad thing. It just means that there is an opportunity to improve our function and recognize what functions are maybe disturbed from those processes like labor and birth. Cranial nerves are also extremely responsive to care. So care like chiropractic care, obviously, craniosacral therapy, infant massage, feeding support, all of these things can be really helpful for all of these different bundles of or different groups of functions that babies are trying to adapt to and create within their own bodies. They're really, really adaptive nerves. Even in school, we're going through all of these cranial nerve exams, and students, myself, you'd be like, oh my gosh, I have a dysfunction on my right vestibulocochlear nerve, and that means XYZ. Like, I find out so many crazy cool things about myself, and it doesn't mean that I have any judgment on myself where I'm like, oh, now I'm limited because my right ear doesn't hear as well, or whatever it is. It just brings me a better awareness to all these cool things in my body and where my small little dysfunctions are. That's what the point of knowing this stuff is. When you're able to recognize it and identify it, you can take action in preventative care. Preventative care is 1 million times cheaper than reactive care. And if we can prevent a ton of these very common dysfunctions that we're seeing in kids and school-age kids now, why not? Why wouldn't we try to be proactive and really make sure that our babies are functioning and growing their best and strongest from the start? So I want to talk about how birth impacts cranial nerves because it really does have a big impact on cranial nerves. You've heard me say it before. Birth is not about getting your baby out, just getting your baby out. It's also their first big neurological event, especially when it's a vaginal delivery. The cranial nerves exit directly from the base of the skull and the brainstem These nerves are delicate and easily influenced by pressure, rotation, and traction. When I say these nerves, some of them are no thicker than a piece of floss. I mean it. They are tiny nerves. They're tiny nerves. And I'm looking at these nerves. Hopefully this doesn't gross anybody out. In my cadaver anatomy class, I'm like, holy moly, these nerves are tiny. And I'm working with a cadaver that is taller than myself. Imagine a baby. Their cranial nerves are tiny, very, very small, very, very thin. And they're going through a lot of pressure, a lot of rotation, a lot of movement changes through a very small hole in order to get out. So there's going to be a lot of pressure and stress in and around the very top of their neck, often where these cranial nerves come out of, that can start to shift how they experience the world. Again, this is normal. It is a normal experience for your baby to be delivered through the vaginal canal. However, with that, we have to be aware of what actually happens, and that's why we have preventative care. This is why we have chiropractic, starting at the root cause of all issues that most people experience. We're not symptom-based chiropractic or symptom-based doctors. We're really working from the root. That's why I love working with babies, because I get to work with humans from the very start of their life, and we are now getting to project how amazing the rest of their life is going to be because of how much awesome recovery and stabilization we've been able to do after a very normal event. It's just an intense event. Tangent, always. Anyways, during birth, the baby's head and neck are often compressed, twisted, flexed, or pulled, especially in assisted deliveries. So an excess pull can also strain those cranial nerves. That means your baby's first movements involve massive stimulation to the exact area where all these nerves exit and operate. Birth scenarios that can affect cranial nerve function. Now that we know that it can affect cranial nerve function, let's make sure we're aware of what types of births this might happen to, so that if this is your birth, you can be aware, hey, I want to look at the cranial nerve function of my baby because I've had XYZ happen during my labor and birth. So, long or stalled labors. Baby's head may be compressed in the pelvis for hours. Can lead to tension or asymmetry in cranial bones and neck. May show up as tight jaw, difficulty turning head, or fatigue while nursing. None of this means there's anything wrong with your baby. It just means that there's some strain on their cranial nerves, most often relieved and stabilized through chiropractic care and craniosacral therapy. Again, a lot of chiropractors are trained in craniosacral therapy. I am myself, and I have a lot of patients who come and they're like, I just went and saw my craniosacral therapist. And I'm like, awesome. Did you know that I also do that? And they're like, oh, I had no idea. And I'm like, whatever. So always worth asking your chiropractor, do they know craniosacral analysis and adjustment techniques? They're often really, really gentle. A lot of times there's no pops or cracks that happen with craniosacral therapy. Side note, if you take your baby to a chiropractor postpartum, or have a chiropractor come to your delivery room, postpartum, whatever it is, no chiropractor is going to crack your baby. Chiropractors don't crack people. We crack eggs. We adjust humans. An adjustment on a baby does not mean there's going to be a sound of pops and cracks. There actually is, that never happens. There's not even joint spaces created to allow that to happen. It looks like an amazing baby massage, while also initiating a lot of their nerves and stimulating their reflexes that they should have from those nerves. Again, tangent. Very fast or precipitous labors. Baby passes through the birth canal with little time to adapt. Sudden pressure changes can be overwhelming to the nervous system. Babies may seem more easily startled and or dysregulated. So a lot of times I see this with forceps or vacuum births, where babies are in the vaginal canal, they're close to coming out, but they're stalling or stuck by whoever's determination. And then it's often recommended that they pull out the forceps or the vacuum, and those pull baby out so quick that often this is what you would consider very fast labor. That pulling motion pulls a lot on babies' cranial nerves. And so we want to make sure, if you don't want that to happen, that that's very clear in your birth plan. No assisted delivery unless medically necessary, which again, there's very, very, very few reasons why it would be medically necessary if that's not your wish. This can also lead to common bruising, feeding difficulties, or side preferences, especially with the vacuum and the forceps, just because a lot of times it's pulling baby in a very specific way and it can pull on muscles. So if baby's whole body hasn't made their rotation to shoulders even with head rotation, and then the neck is pulled on, you're pulling on one side of the body that is extended and one side of the body that is flexed. And that's going to put strain on both sides of the body, just in different ways. Cesarean births, usually a lack of vaginal compression is where I see neurologic stimulation reduced for some of these babies. It doesn't mean that we can't increase it or bring it back. And a lot of that comes with some of that cranial squeezing if babies do come through a cesarean birth. So what I call that vaginal squeeze is the baby wake up. That vaginal squeeze is what actually pumps the fluid in and around the brain to wake up the brain and the cranial nerves at the very bottom of the brain that are about to exit into the body. That vaginal pressure around baby's head pumps all that fluid and pumps the start, or flips the on switch to the entire nervous system. In cesarean, they're not squeezing through 10 centimeters. They're being just lifted out of, sometimes pulled out of mom's very open belly. Sometimes these babies are more sleepy, less alert, and have trouble coordinating with feeding early on. Again, those are just some of those reflexes that baby gets with the vaginal squeeze. That rooting reflex, that sucking, that latching reflex often comes through the vaginal squeeze compression around their head. They may have subtle tone issues or poor vagus activation. When babies birth through the vaginal canal, like we've talked about before, when their heart rate lowers, their vagus nerve is stimulated, they get to practice calming their bodies down and then stimulating it and then calming their bodies down. I keep saying babies. In a cesarean birth, often, depending on how we got to the cesarean birth, if it's a planned cesarean, baby is not often engaging that vagus nerve to calm down. Maybe you're in a stressful birth that goes to emergency C-section because baby isn't calming down or their heart rate isn't going down in between contractions. And same thing, they're not getting that chance to activate their vagus nerve to calm down, and so they can have some tone and calming issues postpartum. And then the last one I have is intrauterine positioning. Breech or transverse babies, or funky position babies, can have cranial nerve tension before birth. Most babies do not have cranial nerve tension, strain, dysfunction prior to birth. A lot of times it comes because of birth. But depending on some babies' positions, they can have some strained cranial nerve functions immediately coming out. And it's not something that you did wrong. It's not something that they did wrong, but it is something to be aware of and start to work with. So if you're like, I don't know how to be aware of that, I don't know if my baby needs cranial nerve testing, or even after listening to this episode, I can't decide when I would be able to recognize if my baby has cranial nerve dysfunction. That's okay. Take your baby to a chiropractor and tell them your worries or your concerns and be like, I don't know if I need any of this, but I feel like I want to have my baby checked out. Most of the time, somewhere in your body, there is some tension, strain, stress. Why not clear it out? We offer at our office a complimentary spinal check for all fresh babies and an adjustment if needed. Every single baby that has come into my office immediately postpartum, no matter how amazing the birth is, has needed an adjustment. Maybe not a serious one, but they've needed some sort of an adjustment. Again, it's very gentle. It looks like I'm touching babies or like picking lint off of their clothes. Like that's literally how gentle the newborn adjustments are, at least with Dr. Emily. So it's not about a good or a bad birth. Every type of birth can come with its own patterns of strain. The goal here is not judgment, it's awareness. Be aware of how intense and how big birth is. It's okay that your baby's going to have some strain and stresses on their body. You're going to have some strain and stresses on your body from birth, but it's a natural event. It is what our bodies were designed to do. So it's okay if any of these things are happening. Let's just bring awareness to it. When we have awareness of what is going on, and we can do something about it. If we don't know, we can't know. What is it that I always say? I don't know what I don't know. I'm trying to think of an example that's not embarrassing, but the one that comes to my brain is pretty embarrassing. Immediately upon graduation, my mom told me that I had to start taking care of my car payment. I was like, great, who do I Venmo? She's like, Venmo? You can't Venmo your car payment. That's like a real human payment. Like you have to, what? Like, how do you know? And I was like, I'm sorry, I've never made a car payment before. I don't know what I don't know. I realize you might not know a lot about your cranial nerves, but now you have some awareness that they even exist and that they actually help your baby function. So when we see something funky about our baby, or we're like, that doesn't seem normal, you can have an awareness of, I wonder if it has to do with their cranial nerves. It does not mean that you need to go on some Google rampage, scroll, trying to find every answer in the book, but finding the awareness and then bringing that awareness to a trusted practitioner that you've been getting advice from and that you trust their advice from, that you've used and it's been successful for you guys, take it to that person. The clues that I have for being able to recognize if there's been some sort of cranial nerve impact are, again, I'm repeating these. I'm hoping by the end of the episode they will stick in your brain. Baby favoring or turning their head to one direction, has a weak or inconsistent latch, clicks or chokes while feeding, has trouble staying asleep unless held or upright, gets overstimulated easily or has intense startle reflexes, and seems too calm or hard to wake up for feeds. These babies are not broken. Again, these babies are not broken. They are just doing their best with the wiring that they have right now, and they're showing you, expressing to you in some way that there's some cranial nerve dysfunction. It's very difficult to identify that cranial nerve has dysfunction, especially if you've not been trained or educated in cranial nerves. But now you have the awareness. How to support the cranial nerves. Chiropractic care, cranial sacral therapy, breastfeeding and feeding support, and then infant movement and regulation tools. So chiropractic and cranial work, usually most chiropractors for babies and children are very, 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 very gentle. Chiropractic care helps restore balance in the neck, jaw, and cranial bones. It can and help improve latch, reduce reflux, and support digestion and ease tension in the body. Again, we're not cracking babies. We are adjusting, checking their cranial nerves, making sure that all of the reflexes from their brain coming out through their spine and not from their spine are all working well and functionally for their bodies. Cranial sacral therapy is a gentle hands-on technique that supports the cranial sacral system. This therapy supports brain, spinal cord, cranial bones, and surrounding tissues. It can release fascial restrictions, compensation affecting nerve pathways, especially helpful for babies with feeding challenges, birth trauma, or sensory overwhelm. Again, this is a really, really gentle form of body work. This is to help babies integrate thoughts that they're having, expressions, and ways that they're perceiving the world, and helping it mesh into one cohesive story within their body. Breastfeeding and feeding support, IBCLCs, really long acronym, but that's pretty much all all you will hear, or lactation consultant. These are body-aware feeding therapists that can help assess latch, oral tone, and coordination. Feeding issues often start with the nervous system, but show up as nipple pain, reflux, slow weight gain, or frustration at the breast or bottle. A lot of times this has to do with your posture. So I am saying bring in your IBCLC if you need them, or a lactation consultant. Also, keep seeing your chiropractor. Tell your chiropractor if you're having breastfeeding issues. I ask all of my moms how breastfeeding's going, just to see if there's any way that we can help posture the baby. Posture is a verb, and it's how you move through the world with your spine. If babies are trying to feed at your breast and they're like this, it's not a great posture to drink. Think about drinking milk like this. A lot of times, though, this is how we see babies curled up and tucked into their mom's arms trying to feed. You have to be able to feed like an adult would drink milk. So this is what we work on in our office, is helping babies and helping moms put babies into a posture that's really supportive for their system to have a really successful, effective feed. IBCLCs help with this too. They just have some different specializations, especially around the latch and their ability to position the head in line with the nipple or breast. Sometimes it's not a feeding problem. Sometimes it's more of a neurological issue, and that's totally addressable with the right support. Both lactation consultants, and honestly, lactation consultant and a body worker of any kind, chiropractor, cranial sacral therapist, dream team for your baby. Infant movement and regulation tools. We have tummy time. This counts if your baby's on your chest. That totally counts as tummy time, and it's really great to do, especially right after breastfeeding. If you guys aren't so hip or tuned to like the on the ground tummy time, if your baby really likes that skin to skin, you can breastfeed and do tummy time on your chest. If you lean back, have baby lay on your chest, that actually helps them with their the burping. It actually helps put some pressure in and around any air bubbles in their tummy, and pushes out a lot of burps for some babies. It doesn't work for every baby, but it is something that you can try. We also have baby wearing promotes nervous system regulation through contact and motion. Like we've talked about, your baby knows your motion. They're really familiar with your touch, your smell, your tone. And so baby wearing really helps babies regulate back into their cranial nerves and what they need to function properly. Swaddling and skin to skin, same thing. It allows baby to feel that pressure, feel comfort and safety, similar to what they felt inside the womb. Think of these things as nervous system snacks. Small, frequent doses of connection and movement can help the baby integrate and feel safe. So again, these are small snacks. And remember, as much as you can add these into your daily routines, it's the more baby's going to be able to integrate these reflexes and necessary movements for soothing, for nerve, cranial nerve, and nervous system regulation. Tummy time, baby wearing, infant massage. Oh, I don't think I said that one. Make sure we go back. Infant massage, massaging your baby, massage them all over. And then swaddling or skin to skin connection. When to seek support. You do not need to wait for something to be wrong. I've said this so many times. You do not need to wait for something to be wrong. Why not be preventative? If you have access to be preventative in your child's health and in your own health, be preventative. It is way less expensive. It's way more productive. And honestly, it's a lot more encouraging because nothing's wrong yet. You may benefit from a cranial nerve informed provider if feeding feels funny, if baby seems stiff, fussy, or super sleepy, if you feel like you are trying everything, but something's not clicking, if your intuition says something's off, but at the end of the day, trust your gut. If it's not on this list and something just feels wrong, or like you want to get this examined or talked about, go do something about it. Don't wait until you do notice something very specific that I said in this episode. If you feel like something's off, go get it checked out. Trust your gut. The more that you act and trust on your gut, the better it will build. The better your mom instincts will build, and the more attuned that they will be to your baby. Key takeaways. Your baby's cranial nerves help them survive and connect. They are adaptable, responsive, and often just need a little nudge after birth, especially some of those feeding ones. They just need some support to learn the nuances of a brand new experience that they're going to be doing for a while, feeding. There are skilled providers who understand all of what I've just talked about and can help. I hope you enjoyed that episode. Cranial nerves are the direct connection between your baby's brain and their body and how they experience the world. So it's really important to have some awareness that these nerves exist. They can be strained, they can be stressed, and they can present really common funky things in babies that we dismiss or different providers start to dismiss. I'll be the first provider to tell you these things that you're recognizing in your baby that you're like, this isn't normal and nobody can find an answer for me. There's probably an answer somewhere. A lot of times it has to do with the nervous system. A lot of people don't look at the nervous system. That's what a chiropractor's for. We're skilled in nervous systems, not just spines. Spine is what houses the nervous system. So yes, we have to be skilled in the spine. But our main knowledge bank is in that nervous system. This is very much the sciencey side of pregnancy, labor, birth, postpartum that I really love because it's what I learned in school and it's what I know best. This is really where a lot of my information is held. I used to be the cranial nerve queen, and I could tell you anything about cranial nerves, their order, what they did, whether they were sensory or motor, whether they were both. Like, I could give you an acronym for every piece of cranial nerves, and if you really want to learn all of them, I'm happy to teach you. Let me know. I hope that you made it to the end. I've said it many times in this episode, but this is not for you to memorize all the cranial nerves and go try to figure out which one is which and all the stuff. This is really just to give you some awareness of all the different inner workings that go into your baby's processing and adaptation as they come into the world and how they perceive the world in front of them. If you found this episode insightful or helpful in any way, please share with another mama to be a doula. You share it with anybody. You can share it with your husband if you want. But this was just more information on cranial nerves. I hope you enjoyed this episode. Please feel free to leave a comment or a question if you have a specific question about a specific cranial nerve. And can't find it on the internet, whatever it is. Drop a comment, send me a DM, leave a review, like, whatever feels good to you. Thanks so much for listening. I hope you have a fabulous week. I'm Dr. Emily, and you've been listening to the Popped Podcast.